Hello all, I'm here to talk about the benefits of electronic prior authorization. So, what is the use of technology if it doesn't improve the patient's health and as well as the safety? So, electronic prior authorization is definitely an initiative to improve the patient's health and safety. American Medical Association has surveyed one-third of the providers, and they came to know that the prior authorization delays can definitely result in serious health problems for patients, including hospitalizations. The HL7 industry standards has published implementation guide for implementing this electronic prior authorization, and they are publicly available in hl7.org. So any payer that wants to implement electronic prior authorization can go to the hl7.org and avail the implementation guides and implement the process. The whole intent of electronic prior authorization is to reduce burden for all the stakeholders involved. So I'm going to talk a few benefits for how it is going to help the payers. So the payers have to go through a lot of manual review process, which requires a lot of clinically trained resources on their side. So these processes, these rules, these medical guideline policies can be systematically programmed in an electronic prior authorization process, which could result in avoiding a lot of manual reviews and which could also result in not needing very clinically trained resources to be performing a time-consuming review process. And also for the providers, if you look at it, the providers have to go through and submit a lot of documentations for the payers to review to get to an approval or a rejection. So this requires a lot of communication back and forth between a provider and a payer. So the payer have to do a lot of documentation, fax a lot of documentation, call the payer's office a lot of times to get to see what kind of a documentation needs to be submitted. All these manual processes can be completely avoided with this electronic prior authorization. Electronic prior authorization is intended to be real time. That means when a provider wants to start a medical treatment for a patient, they can immediately check with an electronic prior authorization process to a payer and check if there is a need for a prior authorization approval for the treatment plan that they're going to be doing it for the patient. If a treatment plan is, if a prior authorization is required, then the payer can suggest the provider saying that what kind of a documentation and test results are need to be submitted for them to review and approve the medical treatment plan. So this definitely reduces the timeline for a medical treatment plan to be initiated. And the other important factor for both the payers, providers, and as well as the patient is it reduces the cost. Typically, an electronic prior authorization is supposed to cost about $14 for a payer to have the medical review done. And also it takes about several weeks for the authorization to be approved or rejected. So it can reduce cost for both the providers, payers, and most importantly, it provides a faster decision for a patient to start a medical treatment uh, plan. According to a survey from AHIP, the greatest benefits arise from providers who uses electronic prior authorization for most of all their patients. The providers who use technology are benefited the most, and the benefits are bigger, and it reduces the burden for the providers to submit the whole documentation process and also to get a better results and better treatment plan for the patients. So these are the four most benefits that we can see for the implementation, but if you implement an electronic prior authorization process. Thank you.